Hey guys, this is my journal club for February. The article I choose to look at is called "The Clocks in the Clinic: Circadian Rhythms in Health and Disease" in the Postgraduate Medical Journal. So the problem or case that attracted me to this paper was the fact that it's dealing with how circadian rhythms affect health and disease overall, and that's kind of interesting. And that kind of encompasses what we've been talking about in the whole class, and it brings it all together. So that's why I was attracted to this paper. So this study specifically, it is an analysis looking at the research about the impacts of the circadian rhythm on health and disease. And the research question is, what impact does the circadian rhythm have on health and disease? And it's really a meta-analysis, taking a bunch of different articles and looking at it and looking at all the different evidence to see like where it stacks up. And this question is important because if we can alter the circadian rhythm in a positive way, we may be able to treat diseases that are heavily impacted by circadian imbalances. And we'll get more into those in a second, such as psychiatric or metabolic imbalances. For the methods, this is an analysis, so they're just looking at different papers. And then I'm going to summarize the primary results. So I'm going to split this into two categories. First, they talked about circadian rhythms and psychiatric disorders. So I'll talk about their results for that. They said that patients with major depressive disorder, or MDD, display altered daily patterns of affect with rhythms of low mood showing a later trial in the early morning and a blunted amplitude of the mood rhythm compared with controls. They also said that these findings indicate that a phase delay of the circadian clock is associated with a non-seasonal depression, and this forms the basis for the use of bright light morning therapy as treatment. They also conclude that the underlying circadian phase may also modulate the efficacy of antidepressant pharmacotherapy. And seasonal depression has been long associated with changes in the circadian system in response to changes in the photoperiod across the year. And lastly, in terms of this topic, they conclude that the circadian disruptions and alterations in circadian parameters have been reported in patients with bipolar disorder. So they to go over that just real shortly, they pretty much conclude that people with MDD or bipolar disorder or other psychiatric conditions may have some disturbance in their circadian rhythm, or vice versa, where the circadian rhythm is disturbing their psychiatric disorder or bringing it to the forefront. And then the second topic they kind of discuss is circadian rhythms and metabolic health. So I'll talk about the results real quick. They conclude that poor sleep quality, short sleep duration, and missed time sleep are associated with an increased risk of disorders, pathologies, and dysfunctions such as insulin resistance, type 2 diabetes, obesity, metabolic syndrome, and cardiovascular disease, and even all-cause mortality. And they also say that some social obligations can affect the alignment of an individual's behavioral cycle to the endogenous biological rhythm, though altered sleep and wake times on work and free days resulting in circadian misalignment. That's pretty much referring to the shift workers who purposely alter their rhythms, which may be bad for the health. And then last thing that they conclude is that social jet lag has been associated with higher BMI and increased risk of type 2 diabetes and metabolic syndrome. And social jet lag is kind of the obligations that as a society we kind of live like an 8 to 5 kind of mentality. So those people who have to work like a night shift and they do that consistently have an obligation to almost abide by, that 8 to 5, and that can mess up their rhythms. So overall, describe why I think these results can be applied to my patients or situation. So for my future patients, I can advise them on lifestyle and sleep hygiene to improve their health. And as an OB, I still have to confront poor lifestyle choices because they impact health, especially like doing with like diabetes and pregnancy and things like that. And then conclude with my own decision on the utility of the study in my own practice. So if someone is struggling with their blood sugar levels, such like A1C, I can advise them on lifestyle changes and, trying to avoid the night owl or, being a third shift worker. I know that's not always avoidable, but I can advise them on that because that is, from the studies, has seemed to be related to more poor outcomes. And I could also suggest phototherapy for seasonal depression or excessive fatigue in the mornings, which has been shown to work. So that is all I have for today. Thanks, you guys. and I'll see you in class.